Good Monday afternoon. I'm Dr. Martha Buchanan, excuse me, Public Health Officer and Senior Director here at the Knox County Health Department. Our moment of gratitude today is dedicated to our library staff, Medical Reserve Corps, and community development individuals who are assisting our teams with contact tracing. As cases continue to increase, the workload of those who are performing contact tracing also increases. We are very grateful for these individuals who've jumped into our pandemic response and are making significant contributions. Now, a quick note about testing. During our testing opportunities on Monday, Wednesday, and Friday, we are experiencing a large number of individuals who wish to be tested. We will continue to test folks from 9 a.m. to 3 p.m., but based on volume, the line will sometimes need to be cut off earlier than 3 p.m. to allow time for tests to be processed and sent to the laboratories that evening. As a reminder, we know this week is going to get hot. So if you're planning to come to get tested, please bring a bottle of water and a lawn chair if you'd like to sit while you're waiting. We quickly want to address a parody account we've recently become aware of on social media. This account appears to be KCHD, but they are not. Please take caution when sharing information from accounts where you're not sure if they are legitimate or not. If you're interested in following us on social media platforms, our Twitter handle is Knox Co Health TN, and our Facebook handle is Knox County Health Department. Now we'll move on to the local situation. We've had 1,628 confirmed cases of COVID-19 in Knox County. Additionally, we have 63 probable cases. 879 of our cases have recovered, giving us 736 active cases. 130 individuals have been hospitalized at some point in their illness. 41 Knox County residents are currently hospitalized. And sadly, we are reporting 3 additional deaths due to complications from COVID-19, bringing us to a total of 13. Our heart goes out to those families who've lost loved ones and the friends of those folks who've passed away. In regard to our numbers, the updates we provide daily are a significant undertaking, but we have prioritized providing these numbers daily because we think it's critical importance to our community. They are as real time as they can possibly be. Please remember this is an extremely fluid situation and it is evolving rapidly. Reporting data in this fashion is new and is a new and unique process for public health, not just here, but across the country. That said, we're experiencing lab delays for multiple reasons. An increase in volume of testing, the availability of testing supplies. Because of this, we believe the lower numbers we have seen over the past several days are not an indication of fewer new cases, but rather the result of lab delays. We're keeping a close eye on this and we'll continue to update our community accordingly. As a reminder, the next Board of Health meeting is this Wednesday from 5 p.m. to 7 p.m. The public can watch the meeting live on Knox County's YouTube channel or the Knox County website. I'll now open it up for questions.
All right, go ahead and submit your questions into that chat feature, and please remember to type your name and the media outlet in which you are affiliated with. First question is from Megan with WBLT. Has contact tracing research found any evidence to show a link between protests and other large gatherings in the recent case increases?
We haven't seen any links to protests. We've seen links to parties and gatherings of other social kinds of events, but no large gatherings like protests.
From Anthony with WBIR, do you have any updates following the visit from the CDC last week? How will the agency continue working with KCHD?
Well, we were happy that they came to visit to gather information on how they could help us better at the local level, and we look forward to follow-up from them.
Also from Anthony with WBIR, what are the ages of the 3 new deaths?
So one 45-year-old male, a 54-year-old female, and an 88-year-old female.
Any other questions? Please go ahead and submit them now. From Megan with WBLT, how concerned is the health department about the news of new deaths?
It's very concerning. our increased hospitalizations, our increased case rates, and of course, new deaths are all very concerning to us as we look at the situation in our community, and why it is so important that all of us take on the responsibility of practicing those 5 core values: social distancing, wearing a cloth face covering, washing your hands regularly, cleaning frequently touched surfaces, and staying home if you're sick. That is the only way we're going to continue to be able to address both our economy and COVID-19 at the same time. If we drop our guard and we don't practice those things, then we'll have more illness, and then that will also impact our economy. People who are sick don't go to work. People who are in quarantine don't go to work. So that impacts our economy as well.
From Anthony with WVIR, as the younger population contracts COVID-19 more, what are your thoughts on returning to school?
I think returning to school is one of those touch points this fall, in addition to flu season, that we'll have to wait and see how things go. As long as safety precautions are in place and the schools are able to practice the 5 core actions and the students are able to practice the 5 core actions, I believe that they can go back to school safely and be able to protect the staff and the students as well.
Any other questions? Please go ahead and type them into that chat feature now. From Megan with WBLT, when will new information regarding local hospital capacity and available ICU beds be released?
That'll be on Wednesday with our benchmark updates. Charity?
Yeah, sorry. Hi, I think you also might be referring to some information that Dr. Gray provided last week on Wednesday. The hospitals are looking at their surge plans in a different way based on hospitals operating in more of a COVID environment, keeping services going as much as possible. And they're working on those. As soon as we have that information, we'll share it, but that is going to take a little bit of time for them to revisit their plans and synthesize all that data to make it public. But our regular benchmark data will continue to be updated, and it'll be updated for Wednesday.
Any other questions? Please go ahead and submit them now. All right, not seeing any other questions come in, so thank you all for joining us, and we will see you again on Wednesday. And like we just mentioned, benchmarks will be updated Wednesday, and we'll go over them during this media briefing. Thank you, and have a good rest of your day.